is not highly contagious. Okay, it's very different from SARS, from influenza. You are not going to get Ebola except if you are touching a sick person who has Ebola. The person who is incubating Ebola is not going to shed the virus. So, there's been a lot of issue about why we should quarantine the people for 21 days. Well, it's a potential duration of incubation. But if the person is not showing any clinical sign of any disease for that period of time, they are not a source of infection. Only when they start to be sick, and particularly in the advanced stage of the disease, but you know that it just takes less than 8 days to go from flu-like symptom to hemorrhage and to dying of Ebola. And that's really in the final days of the disease that they shed a large quantity of virus. The virus is also quite fragile in the environment. So if you have proper measure of disinfection, 10% bleach and so on, that kills the virus. So major cleaning precaution is very important. The reason why this outbreak has been spreading so much is first because it was diagnosed late, because it occurred in a part of the world where it had never been found previously. So it took a while to clearly identify that it was Ebola and not other diseases such as malaria and so on. Then it affected an area highly densely populated. It affected an area where war had been a problem for the last 30 years. So there was a lack of trust in the health system of those countries. Poor health structure because of financial issues related to the war, related to the poverty of the people. And then it occurred in remote areas where people are still very dependent on traditional healers rather than having access to modern care system. So for example, in Liberia, in Guinea, in those countries, you had about 2 medical people for 100,000 people. So you clearly understand we're not enough medical support to reduce the dispersion of the virus. So that's where some of those key issues were. In terms of the spread of the disease, the international community started really to act when we started to have our own people getting sick. And we should have acted much quicker to reduce the impact of that disease. And it's going to take now months and months before we can stop properly this outbreak. In terms of, very briefly in terms of, because there's been a question, in terms of the role of dogs, it's been interesting because there's been one study that has shown that in remote villages where there were previous outbreak of Ebola, there has been seroconversion in dogs, and up to 30% of the dogs in those villages were seropositive for Ebola. However, never has been clinical sign reported in those dogs. So clearly it doesn't seem that the disease, that the dog gets sick. Second, we don't know what is the role of the dog in carrying and shedding the virus. It seems to be quite limited, but there is need to be much more study to confirm their role, their role in the possible transmission to humans, which I think is very, very small. However, it's a very important factor to use the dogs as sentinels to indicate the risk in the human population.